Hi, it's Jess. So the indications for suctioning are to remove visible secretions, if you need to obtain a sputum specimen for the lab, if a patient's in acute respiratory distress, or if a patient has an inability to generate a spontaneous cough. So first thing you want to do is obtain the equipment if it's already not in the room. The equipment includes closed suction catheter, a vacuum connecting tube, vacuum regulator, collecting tubing, collection jar, and overfill safety trap. Then I'm going to review the patient's chart and see how the patient has reacted to suctioning. And then I'm going to go into the patient's room. I'm going to say, "Hi, I'm Jess. I'm a respiratory therapy student. I'm here to help you get rid of some of those secretions in your lungs and help you feel better." Then I'm going to go over to the sink, wash my hands, apply non-sterile gloves, the blue kind. And then I'm going to go over and put the patient in a semi-Fowler's position. And then I'm going to check the connection tubing by putting my finger over the tubing, and it should be between -100 and -150 millimeters of mercury. And since we're new at this, we won't know exactly how much that is, so we will ask our clinical instructor if that is the correct pressure. So then we're going to monitor the patient's blood pressure, heart rate, their rhythm, their respiratory rate, their intracranial pressure, and their SpO2. We are then going to unlock the thumb port like this, and then we are going to hyperoxygenate for at least 30 seconds so the patient's at 99 to 100% SpO2. Just going to turn it up on the ventilator. And then we're going to lavage the patient if they have thick secretions. You would add 5 to 10 milliliters of saline during inhalation. It would probably take 3 to 5 different times, but you put it in here. And then we are going to tell the patient that this procedure is going to make them cough forcefully, and it's not going to be pleasant, but they'll be okay. Then without applying suction, then introduce the catheter into the airway. So I'm going to go to the procedure. And then on my way out, I'm going to turn, and as I'm pressing the vacuum thing on and off so that it gives intermittent pressure. Vacuum, I meant vacuum. And then this should take 10 to 15 seconds. And then once this catheter is going down, it should go hit the carina softly, and then you should pull it up 1 centimeter above the carina and then start doing the intermittent vacuum. Then you're going to monitor the blood pressure, respiratory rate, heart rate, rhythm, intracranial pressure, and SpO2. While withdrawing the catheter, you should be looking at that, not the patient. Then you're going to hyperoxygenate for at least 1 minute. Then we're going to lock the suction control so the patient can't roll over on it. And then we're going to chart and report to the RN the patient's tolerance and the procedure and the amount and color of the sputum produced. And that will be all.